My company is called Baby Love Advice, and as simple as it sounds, we are now saying that babies do come with instructions, but it's a little bit more complicated than that. Baby Love Advice is founded by a nurse and a mom, me. I have 3 grown boys, but when I was going through my own experiences, although I was a nurse and an educator, when I was having my kids, I had a terrible time with information, anxiety, postpartum depression, and I ended up with 2 boys in the NICU. Going through that experience, stayed pretty close with me. And for many years, as I was a telehealth consultant for a very large organization, I looked at different ways to use technology in maternal child space. Baby Love Advice is actually a service that is enabled by technology. We are employing nurses, nurse practitioners, social workers, nutritionists, lactation consultants, and others to support parents from preconception to early childhood, using technology, as I said, telehealth, online classes, chats, remote monitoring, and other instruments. Our highlights as a company, we are in the middle of our seed round, although we've been around since 2018 and self-funded the entire 2 years. Now in 2021, we started our seed round, and some of the highlights with us, we are a partner to the March of Dimes and Johnson & Johnson. And we also have quite a few clients by now. We are not a pure startup. We actually already quite in business. We averaging about between 8,000 to 9,000 consultations per month. I have 145 active classes and about 200 support groups. We are covering a market of many babies in the United States, 4 million babies and 135 million worldwide. Why are we in a maternal child crisis is a good question. Here we are in the United States of America, being the #1 country in the world by which babies and moms are suffering and dying related to pregnancies. We also seen 129 hospitals shutting down their maternity services since 2018. 65% of all births in the United States are funded by Medicaid. And we know that last month alone, 33,000 babies were born prematurely. All of that with physicians who are burned out, obstetricians who are leaving the business, are leaving a massive gap in care that we are hoping to serve with the physicians using telehealth. The financial spend in the United States around this maternal child morbidity and mortality is in the 400 billions. And the NICU and preterm birth is costing us $26 million a year. We are really looked at how can we work with physician groups, hospitals, insurers, and others to coordinate care better for moms, so they are not necessarily always in a hospital or in a clinic getting their maternal child care. So we are using a telehealth platform that is actually bound by VC platform, who Milton Chen, who is the CEO of VC, is my partner. And we have built an incredible platform that has many capacities to interact as a web RTC without having to download all over the world and here in the United States. Our first hub actually was in Africa, in Kenya. We have hubs in Israel, in Europe, in Colombia. We are about to start another hub in another Latin American country. And here in the United States, we serve in the entire United States. Our technology can be integrated with many other technologies like remote NST, fetal monitorings, ultrasounds, and others. We do remote monitoring of blood sugars, blood pressures, and weights. And we have an excellent integration with Fitbit and iHealth. In essence, we are serving moms from the moment they get pregnant all the way till 3 years of age. We are the only constant for these moms. When they see a doctor, they will then be referred to Baby Love Advice, and we will do all of their education, support, advice, and monitoring all throughout their pregnancies and in real time. Some of our partners and they're growing daily are, as I said, the March of Dime. We are Johnson & Johnson. We're working with Huntington Hospital in Pasadena, Citrus Health, and many other FQHCs and clinical groups. We have wonderful case studies on why people would want to use us on the employer side for sure. We are supporting employers who are paying massive amount of, claims around maternity, trying to reduce maternity costs for them. In the FQHCs, we are increasing their billing and revenue by providing services that are usually cannot be provided online by the FQHCs. And for the hospitals, Huntington is a great example. We have taken over the maternal education department for them, saving them about $495,000 last year. We have many, many very happy physicians and providers. I will move forward with this. The revenue stream for us is contracts per visit fees, Medicaid, FQHC, internal contacts, and channel partners. We have quite a few channel partners like the March of Dime and Johnson & Johnson. Last year, we were in revenue about $250,000. We are definitely on a track to make just about $1.1 to $1.5 million this year, maybe more, depending on some of the contracts that are going to close. Our next big contract is with Emory in Georgia, where we're going to do a project looking at African-American mortality and morbidity in Georgia as mom, and hoping to influence some of those outcomes over there. As I said, we are in the middle of a raise, and we are hoping to continue this. We started this raise with Van Ventures. We are at $500K out of $1 million, and we're hoping to continue raising all throughout April and hopefully close the round by then. I will stop right there, and thank you so much for your time and for your attention.